What's going on, y'all? Happy book day. Happy book day. So, somebody asked me about the workbook the other day. Um, you guys don't have to go to the website to get the workbook. I just put that workbook in there. I'm gonna go ahead and put it. I'm gonna put it on the side for you guys so you can get that link for that workbook. I'm talking about the step-by-step workbook. Okay, so if any of you went on and I pretty much gave you that free version, you don't need to spend $159 on it. There's at least 30% in there, so no, I don't want you to spend that on there. But here it is right here. I'm gonna go ahead and put it in there. I've been putting the book in there. Um, but you guys let me know. Why is it coming up like that? Hold on. Oh, I know why. Okay, so just all right. So we're gonna put that there, and you guys can take a look at that. That is the book that I just put up. That's the workbook. That is the workbook. Okay, that is for the step by step book. So that's kind of what we're going to kind of talk about today. Doing the work in the step by step book. Also doing the coding work that's in there in the workbook. I did put a couple of quiz up, and you guys check out those quiz. Those quiz actually came from last class. This class was actually a 2 hour class for you. I did the other class for Sapphire, which was a little bit different, but you had another hour for this class, and that's because we were actually finished because I just want to make sure we got everything done. You guys had homework to do as it related to the last 3 chapters that we did throughout the week. You guys had homework. So what I did was I just put a couple of quiz out there, but that link that you see right there, that's to the workbook. So what we went over in evaluation and management, you should now be ready to do in the workbook. Okay, so the step-by-step book does have a workbook. What is this? Does have a workbook. And because you guys already have exercises in here, telemedicine, we did that. We didn't have to do the workbook as we go, but some of you do the workbook through chapters. I prefer to kind of get through the chapter and then do the workbook. That way, when you get to the workbook, you will be more familiar with what's in there. So the work that we did, as far as evaluation and management, this one has a lot of cases. This is the one I think you guys did 11 cases. Yeah, you had 11 cases on that one. Um, the 11 to 9, you had 15 cases. You had 15 cases on 11 to 9. And those cases were, where are you? Those cases were actually in the book. So that wasn't in the workbook, so you really didn't need the workbook for it. But I put the workbook up there so you guys can go ahead and get that. And you guys can also go ahead and check out my website when you go in there. I have all the courses in there. The books that are in there, AAPC.com. Yeah, check out AAPC.com. I'm about to put this up here. So again, this second portion for you is just really to talk about the workbook, and then we're gonna do the last portion of this book because I don't want you guys to get confused with that. Um, Let me just get back in there. So I'll just put those two websites up there for you. But 11 to 9, because you have exercises in here already, you don't need to bump both of them. When we finish evaluation and management, we're going to jump on to the other courses. But now it's time for you to start thinking about doing the courses in the workbook. That's why I put that up there. Okay, so there were 15 cases in 11.9, exercise 11.9 in the book. I wanted you guys to go ahead and do that. And it's just giving you exercise. It's giving you exercise, okay? So you should have your CPT book, your step-by-step book. And if you have the workbook, you can have it open. The workbook, the first 30 to 40%, I just put it up there. It's free for you. You don't have to order that, okay? You do down the line when we get into further into the courses. Okay, you do. Okay, right now you don't, because I've already given you the link for it. Nursing facility we did. Okay, you guys did exercises for that. Prolonged services we did. If there's anything that we did in the classroom, the past classroom, make sure you go over it. I'm expecting you to go over it anyway. I'm basically just putting you guys in the right place for the course. Okay. This portion down here, let me see if my cue is right to get you guys in there. It might not be on. Hmm. All right, so we got that. Wait a minute, let me see what's in there. All right, so well, I'm just kind of getting my screen together. The workbook pages. So the workbook should be combined with your step-by-step regular book. And in that book, you should have exercises to also do. And it's just evaluation and management. It's not anything more than that. So, you see a lot of the other stuff in there. You don't have to worry about it because you're doing specific chapters in there. Okay. In the workbook, it's just going to give you more exercises. Okay, so that's why I put the workbook up there for you guys. All you gotta do is click on it and open it. And don't forget, I'm gonna the chats are going to go private. I have stuff up on these chats that I cannot put in here. Well, I'm not supposed to. um, but I have to make these chats private. So these chats will go into the Sapphire Academy. That's the link up there for Sapphire. When you get to Sapphire, you're going to click on Bookstore, and that's where you're going to get the program at. Okay, so don't forget. Okay, when we do that, you will not have access to those classes. You will only have access either to the link or to the Zoom, and in the Sapphire Academy. So I'm probably going to put both in there. Every time I do a class, it actually goes in there, but I'm not going to make the coding private just yet. Okay, but for the medical billing, I want you guys to go ahead and take a look at that. I just reorganized it so you guys can have an easy way to get to it. They have this new tab that's called a course, but I just find it confusing. Just go and look for your playlist and you're good. Okay. If you need to go over a chat, just go ahead and archive the chat. Archive, I mean, just, you can look at the chat as many times as you want to. But I want you to have your books open to where we're at. So we're in evaluation and management in the step by step book. You should have that book open and your step by step workbook. But again, those books, all of those books that you need for my class, I've given you free already. So when you do go on my website and you want the hard copy, then yes, you have to go ahead and order the hard copy. Okay. So let's kind of get started. I'm gonna put this up so I can see. Let me see. I got to do a new one. So let's see what's in here. Dun. I gotta do a new screen capture. I can't even say a screen capture, y'all. So give me a minute. So if anybody is already in school for medical billing and coding, let me know. I mean, you guys, maybe you have something, for us. Maybe you have something you want to share with the class or something like that. Is there anything that you're doing in there that you guys need help with? Um, I mean, it does just because I have the classes here doesn't mean I'm not gonna help others that are already in school. It just means we have classes on YouTube. That's all. Okay. So if you do, if you are in class and you want to X Y Z, ask me a question. No problem. So it looks like we got this right. Usually y'all know I have this up here before y'all come in. But it's really just to kind of put you in the right place, just to kind of show you a little bit, that some of the screenshots that I have in here. Um, this is where we're at. I'm going to take it down just so I can get to where I need to get to. But that's the book that you're supposed to have open, okay? And again, all of the books that you use for my class, I've already given you free. Um, I post them on the side and they are in links, okay? So again, the classwork that we already did, you guys are doing this in your workbooks now, okay? But we're not quite finished yet. We still got a couple to go, okay? We did case management, okay? Y'all already did 11 to 15. We did care plan oversight. Um, all I'm doing is just kind of scrolling down. You guys already have this. You have your book. Uh, I'm just kind of scrolling down in it and just trying to get to where we were the other day. Okay, so all you had to do is also complete the assignments after class. After we do the class, we're just pretty much going over what you're going to be doing. And the Sapphire classes are a little bit more in depth. You get a one-on-one, so we can kind of show you exactly what's going on. You can ask questions there as well. You could ask questions here, or you could just send me a DB and I'll get it. Even if you look at my website and you got a question, you can also ask a question there too. Okay, so the cognitive assessment and care plan services, 99483. Y'all remember we did that yesterday, did that the other day. Okay, care management services, y'all already did that. 99424, first 30 minutes. Physician service, 99425, each additional. We did that already. And basically, you guys are just pretty much going over what we do in the classroom. So what we go over in the classroom, you guys are also going over that at home. I do want to see if you're struggling any to find these codes, because we've done a lot in this class to just kind of put you in the right place in the coding area, okay, for the evaluation and management. Once we finish it, we'll be going on to the surgical coding. So again, the step-by-step book is your training book. That's your training guide, okay, to put you in the right place. Okay, we are going to use the CPC guide, but we're going to use that a little further down the line. Okay, so transitional care management, 99495. And again, some of you who may archive this, if you didn't get in on this chat, this is pretty much what we did. We've done it already. I'm just kind of going over it because this is going to combine with your workbook. Okay, so this book does come with a workbook. So YouTube is what's easy for you is that you don't have to get the test that we have in Sapphire Academy. You can also do these as well. I mean, you're not going to get a pre-test or anything like that or a HIM exam, but you still have tests in here. And I just started putting like little questions and stuff like that on YouTube to see if you guys can get the answers for those. So yeah, so we did that already. And basically what you're going to do is the same thing that we always do. We go over in the classroom and then you look up every code that we go through. So if you see 99495, it's in your step-by-step book. I'm on page 326. You might have a different book. You might not be on 326, but we're still in evaluation and management, where I'm looking at transitional care management services. So I'm right here. Okay, we did this already, but I'm just, somebody new might come in, somebody new might archive, so I'm just kind of like putting you guys in the right place. Okay, and remember, everything on that CPC exam, it takes for you to retain what you do in the classroom. You're not going to remember everything in the classroom, but at least you have insight on what you need to do. Okay, advanced care planning. All right, now don't try to cram just because this is a big section right here. It looks pretty small, but it's a little bit of a big section. We just kind of went over everything that was in it yesterday. Other evaluation and management services. You remember yesterday I showed y'all that the day before yesterday, and that's a code when you can't find the code that you need. Okay, that's the code that you're going to use, and then you're going to send the notes with that code. Okay, you're going to send the notes with that code. 99499. Okay, 99499. Other evaluation and management services is the last subsection in the E&M section. Okay, code 99499 is an unlisted code. That's what we call it, an unlisted code that is used to indicate that there is no other code to use. Okay, that is, you can't find one that's similar to the one that you actually need, then you're going to use that one. Okay, so you had exercises to do. You had 11 exercises that you were supposed to do. I put in the answers on YouTube. All right, I'm putting the answers in the YouTube. So you guys want to find those, you got to go to the YouTube. Okay, but I mean, you can DM me and I'll give you an answer, but I'm not going to put the answer right here. Okay, so your books will probably have even, odd, or something like that answers. Okay, if it's a answer that you need that's not in the back of your book, let me know. All right, so this is pretty much the easy portion right here, where we talk about documentation. So this let me get to you. This is the last portion of your step-by-step book. Okay, this is the last portion of your step-by-step book. It is because the documentation is very, very important. That's what coding is about. You must code from the proper documentation. Okay, Phyllis, I'm gonna put it up right now. You must code from the proper documentation. And knowing about the documentation that you're getting ready to code from is most important. It gets comfortable as it gets down the line. The more, if you work for one doctor and he only has one specialty, it's going to get comfortable. It's going to get comfortable. You're not going to have to um, figure out four different specialties. Okay, there's different doctors, and of course they're going to have different notes. But when you work for one, you don't have to worry about that. You work for one, you're good. Okay, which one you want? Okay, Phyllis, hold on. I got it. I'm gonna put it up there right now. All right. So this is the CPT book right here. All right. So that's the CPT book. Okay. Let me know if there's any other one you want. These are the books that we use for the classroom. Okay, y'all. So again, documentation. You must know documentation. There's no way you can code without the documentation. The gist of the doctors give you the information, they give you the notes, it's already on the paperwork. You got to figure that out as far as these books are concerned. You're going to combine the two together and figure it out. Now, when you work for hospital or physician's office, you are going to use some type of AI equipment. Is it Optum 360 or one of them? Epic, you're going to use one of them. But to get through that test, you have to know step by step how to do it. So, even though all the little AI stuff is going to help you, you still have to be accurate. I mean, it's human beings that put that AI stuff in there. I know it's just the AI thing's driving me nuts. So, documentation is where we are, and I'm gonna get back there in a minute. So, if you got your books, let's go ahead and open up to that. Now, there are exercises with this. Again, same thing. That's why I put the exercise book up there as well. Because when you finish with this, then I want you to go ahead and do the work in your workbook. That workbook, I just put it over there on the side. Okay, so the workbook is over there on the side. The workbook is to this book right here. So, okay, documentation guidelines. Medicare recipients accounts for the majority of patients receiving services in the American healthcare system. Okay, they know that. They know that from codes. They know that from documentation. That's how they know that. That's how we know how many people have COVID, coding. That's how they know how many babies were born in New York. That's how many they know how many babies were born in California. That's how they know how many boys were born. Coding, what we do. Yeah, because it's in the medical record. It's in the medical record. Coding is, like I said, it's almost like the guys that do the IT, but we have a very important part to do when it comes to coding. The providers, they need to be precise in what they're doing, but if they are not, in their notes. All you have to do is query the doctor. Query means ask the doctor. If you get a question on your CPC that says, how do you ask the doctor? Query A. Okay, so yeah, I throw those in there. Um, the CPT book that we have right here, I do use the CPC book. I always kind of use it as a guide when I have classes with y'all. If you can get the book, I would go ahead and get the book. But again, it's not going to come to down the line when we start doing the CPC stuff. I want to start doing the CPC stuff at that point, only because by the time we get there, you guys should be savvy enough. You should be, kind of used to doing the coding. E&M is a long section. And before you even get to the surgical coding, you have to be kind of familiar with, what the codes look like. How many digits is this? How many digits is that? Or, just familiarity with the CPT codes, period. That's what you need to do. It's not going to be overnight, even though I'm doing like an hour here, hour there. You can do 2 or 3 hours, and you can kind of corrugate your program how you want to, because again, this is open. But if not, you can go ahead and get them in the Sapphire Academy class. So again, the documentation that we are looking at right now, you could see it's here. I mean, the same thing is in the guidelines book of CPC. But that's how they keep track it from the codes. Any change by the third-party payer, Medicare has dramatic effects on the healthcare system, and we know that the healthcare is changing right now. When that healthcare changes, this will change. So the next time they print this book, this is what will change. If something has changed with the insurance, the books will change. Okay, CMS will change. Don't forget to go to, let me put it up here, CMS.com. Go to CMS. And you can go there and get updates on anything that's going on federal-wise with the insurance companies. Let me get that. Let me take this down. I have also... I got the let's put this up here, because I'm gonna put this up here, and I'm also gonna put that other website up here. This is an ICD-10 book. I'm gonna put the ICD-10 book up there because the guidelines are also in this book. So you guys remember I gave you CMS guidelines 2025. They're gonna be in this book as well. So again, when you go on Kindle, just click it open and let you see like a sample. You got like 40% of the book or 30%. Which will also help you with the guidelines, okay? Because some of those guidelines are going to be on your test. Okay, so we're here in documentation guidelines. I want you guys to make sure you read those guidelines. If you notice, every time we look for a code, don't they have guidelines right there? They kind of tell you about the code. So if you're a beginner in the billing and the coding world, just take your time. Even in the Sapphire Academy, I don't put a schedule on them. You guys have a schedule, and let's say you started today. You put the time, you put the date that you're going to start, and then you take it from there. Find one of those chests that says schedule, and I should have a duplicate schedule in there just so you guys can see it. Okay, so the Medicare program is the responsibility of the Centers for Medicaid and Medicaid Services, CMS, formerly the Healthcare Financing Administration. Several years ago, CMS determined that there should be a nationally uniform requirement for documentation contained in the patient record when submitting the charge for E&M services. I think E&M services might be your doozy more than surgical. But what we already have went over, and we went over a lot of codes, it gives you insight on what you get ready to look forward to, okay, especially as far as documentation. Because we read stuff in there, if the provider puts this, then we're going to put that. If the provider did 20 minutes, then we're going to pick this code. If he goes over 55 minutes, then we need to put a prolonged service, right? Didn't we go over that? But if you're still stuck on that, don't touch the exercises yet. Don't touch the exercises yet. Because the exercises, I want you to be able to breeze through the exercises. The ones that are already in the reading book, those are the ones that you're doing. If you're stuck on those, don't write in the book. Go over it. Look at one of my chests. I have one of those what do you call those? Those grading sheets in there. You guys can print that out. Well, I don't know. Can you print from YouTube? I don't know if you can print from YouTube, but let me know. I'll send you one. But don't write in your book if you have a hard copy book. I want you to write the answers on a piece of paper, especially in case you need to ask me a question. Because in your CPC guide, what's going on back here? In your CPC guide, I'm still looking at it. In your CPC guide, there are answers in there, but the rationale is also in there. The rationale is how why is the answer what it is, why is the answer what it is. Okay, so when you get to the end part, I hope you guys, all you guys, join Sapphire Academy, or go ahead and get to Sapphire Academy, because the resources in there, you're going to need them to help you pass your test. And the essay that they do at the end of each chapter, it just kind of lets me know that they're good with it, that they're good with what they are reading. Okay, so again, what I want you to do is, I'm gonna fix this right now. What I want you to do is pull out that book. Just click on that website, and you can go ahead and pull out that book. That's all you need to do. It's the same as it's the same as this one, the step by step one. It just says workbook on there. Let me get there. It's just like this one. I'll just put the link up there. It doesn't have a heading. It's just a link there. And I just want to give that to you guys so you can make sure that you get those exercises. Okay. Again, your next class is not supposed to be till Friday, but I did this one extra because I needed to get that extra hour in there. Okay. So again, we're talking about documentation, and it's very important to understand the documentation and why you need to have the documentation. You see that when we were talking about when it was the other code that we had to use, what was it, 99499, unlisted code. You have to have documentation with that, and you need to know what documentation they want to send with it. Okay, and you're not going to be the one to send documentation off. The coders don't do that. The billers are going to be the ones to do that. The coders merely fix the code the case, and it goes through a cycle. It goes through a cycle. You are going to code the cases, and that's it. That's all you're going to do is code the cases. Okay. More than likely, the providers, sometimes they ask questions, but just be prepared. Okay. The standards are called documentation guidelines. These guidelines apply only to E&M services and only to patients covered by Medicare and Medicaid. E&M services represent 50% of all services provided to all these patients. They're saying that because most of our patients that come in are elderly. Okay, most of them are elderly, or maybe they have an issue where they have the Medicare and the Medicaid. Okay. All right, so well, this is a good one right here. This is good for you guys to have right here. I like this one. You see this right here? I would look up this as well. So you guys got that book. I would definitely look up this as well. Let me fix this. I would definitely look up that book. Look up that, because that's going to help you as well. Anything that you see with a link on it that you see inside of this book, if you guys are opening the ebook, it's going to help you. It's going to help you. Okay. So let's get back to this. At the bottom of this, there are exercises. And these are the ones that I'm talking about for you to do. I hope you guys do have your book. So when you guys do archive this, make sure you have your book open. So this is what you're going to do. This is a theory without using the CPT manual. Complete the problem. It ain't no without using the CPT manual. Y'all can use the CPT manual. Okay, that's like no. Okay, so this is just your review. This is your theory right here. And it's pretty much in a nutshell what you did in this whole course. That's all it is. It's in a nutshell what you did. Chapter review, practical. That's what we're gonna do. Here we are right here. So you guys should be on the same page right here. This is the same stuff that we did throughout the course. The only thing that they're doing is giving you a nutshell. So let's say this weekend, this is gonna go over everything that we actually did in the course. The coding that we did. Don't forget the books over here free. I put the links over there because you are going to need those books. Okay, you're going to need those books. Let me see. Okay. So yeah, if you have the hard copy book already, that's fine. If you have the 2022, 2023, that's fine. You can also use that one. Yeah. Okay, so she has a book. Tammy has a book, but her book is it's 2022. If you look in there, I don't think you ought to mess with that one as far as the codes is concerned. The 2025 book codes will be up to date. It's time for 2026 now. But if you have that book and it's 2022, you can go ahead and use it as long as the codes have not changed. You're going to combine that with what we're doing in the classroom. So if you got your 2022 book, I wouldn't fret it. Just go ahead and use it if that's the one you have to use. Okay. She's talking a mile a minute. But anyway, if y'all have an older book, it's okay. Okay, because I have the new book. So even if you have an older book, and y'all not go page by page, even if you have an older book, and we working here on the 2025, you can combine your older book with the 2025. If you see some codes up here that has changed, then you know you need to change those codes, or just ask Miss Lambert, do you need to change those codes? That's all. Okay, but that exercise is what you're going to do. Now, I want you guys to definitely go on that website. Go on that website, especially if you're serious about taking your exam. Go on my website, look in that bookstore, and sign up for one of those registration classes. Now, that gives you access to get into the Sapphire Academy, so you can look at whatever you want to. Because not now, but I will be making those classes private at some point. Just trying to make sure, not the coding, because we're in the coding right now. So you can look at all the coding classes you need to look at so that you can catch up. If you join in this class right now, you can look at all the other classes to help you get to where we are right now. And it's not a big deal. Even if you're not there, it's not a big deal, because you could always go to Sapphire Academy and request a one-on-one with me through there. So when you join Sapphire Academy, you get an email, and then you can request it through there, and I can do a one-on-one with you. Okay. I take you through the portal step by step, so you're not alone. If you have anything that you need, as far as taking your CPC, when you join in Sapphire Academy, when you go to my website, everything is there. The books are there. Don't get the ebooks, because I've already given you the ebooks for free. Okay, they come with the course. Those books come with the course. Yeah, everybody gets those books. Until, I mean, you get at least like the CPT goes all the way up to musculoskeletal system. It'd be a minute before I get to musculoskeletal system. So you can use those books for free. I put them all over here. If Tammy, I know you told me to send you that one, but if anybody else needs one, I'll go ahead and put it up there. David, you. Okay, so I'm gonna put that other step by step book up there. All right, so that was that. Okay, so this is the book, right? This is the 2025 that I'm gonna put. Okay, I'm gonna put step by step book on there because I didn't label that one. Okay, so that's the step by step book in case anybody want that book. Okay, so as far as your evaluation and management subjects that we did in this classroom, it's time for you to do your exercises on it. Now there is. Let me just get right here. Um, so tonight, this is what you're gonna do. You're gonna go over the documentation. I really want you to go over all of the subjects that we did from this one. going right here, stopping from cognitive assessment and care plan. So even though we went over it already, I still, cognitive assessment and care plan is a little funky, so I still want y'all to kind of go over that. I got a lot of emails on that one. Basically, you're just really going to go over that. You're not going to get a lot of that on your exam. You're not even, I mean, go to AAPC and you see you're not even going to see that on your exam. You're only going to have like three medical questions on your exam. You're not even going to have a lot of that. So don't get scared. Don't get scared. But you guys can go over that, if you choose to. I'm giving you that leeway to go over that because your next class is not until Friday. Okay, your next class not till Friday. It ain't gonna be till 7 o'clock. So the cognitive assessment and care plan, care management, chronic care management services, 99437. Go look at that code. Okay, 99439. I want you to go look at that code. Okay, so anytime you see codes that come up in this book, I want you to go look for them, and that gets you used to, looking for codes. Psychiatric collaborative care management services, transitional care management service. It's really small. These are like little small areas that we did. We went over them, but I still want you to go over them. I can't read them word for word, but y'all know what I'm talking about. I want y'all to be in the right place. You're gonna still combine this with your CPT. Okay, in your CPT book, whatever code you go over is still going to have guidelines, what you see right here, and that's going to get you used to it. It's going to get you used to it. Um, the books that we are going over right now are the same books that we use in my class. Okay, in the regular, Sapphire Academy class. Okay, they're the same books. So make sure you guys watch the videos. Make sure you guys watch those videos. I'm trying to get everybody in to, watch those videos so we can get enough of time in. If I can get enough of time in, I can do the whole class on here. But I have to figure out how much are they limiting me. This is not even supposed to be here. I don't even really supposed to put that chap up for 30 seconds. If they shut it down, that's the reason why I have to put them private. And these videos are already on Zoom. So when I record here, I record them on Zoom. Same thing. But I have to make it accessible for you guys to get to. So let's hope that, we've given you enough that you can study for your test. The gist of this is so you can pass your test. That was also a question that somebody asked me. Yes, this class gears towards you taking your CPC and passing your exam. That's what it's for. Putting you in the right place so you can take your CPC and pass your exam. When we start going over the coding in depth is when you're familiar with ICD-10 and ICD-9. This is what's getting you familiar with ICD-10 and ICD-9. There are two other parts to these classes, that you do need to know, to put you in the right place. I mean, on YouTube, there's only so much I can teach you on YouTube. Due to they got a lot of restrictions on here that I'm not supposed to do on here. But in Sapphire Academy, I can do whatever I want to do in my classroom. I use material how I want to. Here I cannot do that. So I want you guys to just try your best and, study as much as you can till you can get yourself used to, looking at those codes and going into that exam, letting that proctor see your book, and boom, you got it. Okay. It's kind of tough when you're taking something that you've never did before, and you don't know what society is going to be like. You don't know what they're going to be hiring for. You don't know, you don't know what next year is going to bring. So to me, when you do learn a new skill, I think that is good, to keep you abreast in certain things. Everybody starts over. If you do something and let's say somebody got laid off, I mean, everybody starts over. Life is not going to be easy. Life is not easy, period. There's some where life is just breeze through the waves. But I mean, you're going to have to struggle. You're going to have to fight for what you want. If you choose to take a class, then you should be able to complete the class. I mean, y'all know me. I don't let my students just wander off. I try to keep it with y'all to make sure y'all on the right track. Okay, so don't get discouraged. If it doesn't even have to be coding, I don't care if it's whatever you're going to school for. Okay, whatever you're going to school for, just try your best. Try your best and do what you need to do to get there. It's hard when, you coming from corporate. I know people who was at the top. six figures. And when they started doing them layoffs, and nobody knew who would get laid off. And I mean, like, I see one of my besties, one of my matter of fact, one of my, I'm not gonna say who or whatever, but she'll act like it's okay, and we're just out in the random, and you'll just see her just she just drift off, like, and I know what it is. It is the fact that she's six figures, she's up there in the systems, and boom, they just give you your walking papers and they give you your severance pay, and then you're like, well, what I'm gonna do for the so and so? You gonna go on every trip in the world until all that money is gone, and then you're gonna be like, I need to get hired again, and then all this crazy stuff going on, you're not hired. The young lady that was on the Twitter, she says she has 4 degrees and she can't even get a job. That's the worst part, So that's why I want you guys, just if you put that resume out there, just keep putting it out there. If they don't hire you in Cancun, they hire you in New York. Just keep on doing it. Just keep on doing it. So again, don't give up on this class. Just take the classes in stride and follow the playlist. The playlists, I put them in order so that you can find your classes just like any other online school. That's the playlist. Okay. uh, the orientation playlist is in there. It says orientation playlist, okay? It says orientation playlist. So before you even start this class on YouTube, look at the orientation playlist. The orientation playlist tells you about the class and what we are going to be doing. That's what it tells you about the class and what we are going to be doing. Uh, there are times that I do stream across the board. I put Facebook. I always stream on Twitch when I come in. So if y'all have Twitch, y'all get on, sign up onto my Twitch. I changed it to Fabulous Me 1000. I'm gonna change it again, but because I don't know what to change it to. My friend is on Twitch. The guys, they're so wonderful. They, they want me to do Twitch, but they ain't give me a good name, so I just made up a name. So, again, don't give up. Don't give up. Whatever you want to do online, don't give up. Y'all can see some of my chats and some of it. A lot of that stuff I be talking about is real. A lot of that stuff happened to me. A lot of that stuff happened to me. Especially the thing with the bariatric surgery. They drove me nuts with that. Um, it's just take your time and do what you need to do. That's all. Take your time and do what you need to do. If somebody says you can't do something and you know you can, take your time and do it. Okay. So let's get back to this class. If I lose everybody, I want y'all to still archive this class. So let's put this back up here. These are the codes that you're going to be working on. If you have any problem, I'm going to put some of these questions on the YouTube for you guys to look at. Okay, you got to give me the answer. Okay, I have a couple out there. I don't know if y'all are giving me answers, but I'm going to put some of the questions still out there. Okay, so this book, we actually should be finished. You guys have to do that chapter. That was the other day. That was 11 that we did. The documentation guidelines. So also I want you to hit these links down here to click on these documentation guidelines so you can understand what they are referring to. Whatever guidelines the CMS Institute for Patients have a dramatic effect on the systems in the healthcare and will soon spread to other third-party payers who will then begin to require the same or similar documentation. In other words, this is what they want inside of their documentations. CMS has specific guidelines as to what they're looking for in their documentation. So you guys remember the thing that we went over in the medical billing class. It's something called, it's a quality measure for doctors where they actually do get an incentive in there. I don't know what that is over there. They do get an incentive, and that they have to submit a certain amount of work, and then work has to be in order how Medicaid wants it, or they won't get it. Yeah, we were talking about that the other day, the incentive that the providers are supposed to get. Yeah, you saw that what was it? It was a tweet. It was what was it? No, it was a short. It was a short. It's a short in there that I put in there. It was Denzel Washington movie, and it was regarding one of the doctors getting incentives. Uh, even if they're sending patients away and they're still getting money. I mean, it was hilarious. I think I got like what was it, like 2,000 views, 10,000 views or something like that. Well, if I find something, and I haven't really been that constructive. Um, you guys know, when you find something and you're just totally, I can't put the whole thing on YouTube. YouTube is going to get me already, all this stuff I put. I'm not even supposed to have this up there, really. But I don't care. I'm putting y'all in the right place. Okay, I put y'all in the right place. I want to make sure y'all got the right book. But, when you see something and you want to inform the people of what's going on, you have to let them know. Just like, a young lady she had some services done, and, the company said, no, we're not paying for it anymore. The doctor's office and the billers, they need to appeal that. They need to show the insurance company why this patient needs this services. Then they need to fight it until they pay it. Because right, you can't just give up. It's not. It depends on the doctor's office and how much they're gonna fight. That's why we have a service at Sapphire that also says that we help you with your explanation of benefits, and we try to fight for you. We try to get services approved for you. The poor girl that had the cancer, did y'all see that one? The poor girl had the cancer, which I've never heard anything like that, but they say the insurance company denied her chemotherapy. How can you deny chemotherapy? The patient needs chemotherapy. I just don't understand that. I don't understand that. But, you have to fight. As a medical biller, you have to fight. Okay? So don't sleep on the medical billing, y'all. I want y'all to also learn the medical billing as well. All right. So the chapter review, you're going to use your CPC. The 4 types of patient status are... Hi, Linda. Okay. The first outpatient visit is called the blank visit, and the second visit is also called the blank visit. Now, we already did this. Now, like I said, they're giving you this in a nutshell. So the evaluation manager is actually finished. We're actually finished with the class. I'm just talking. Okay, but I want you guys to still make an effort to go to my website and get into the Sapphire Academy. Get those resources from the Sapphire Academy. Okay, get the access from the Sapphire Academy. Get the downloads from the Sapphire Academy. Because that's what's going to help you also with your CPC. Okay, Twitch, I'm talking to you too. I want y'all to make sure y'all go on my website so y'all can check that out. Okay, let me see what's up here. I'm gonna close that, and then I'm gonna go in here. Let me see. Yeah. So you have 1, 2, 3, 4, 5. You also have cases in there. Okay, I want y'all to do that case. Well, let me see these cases. I might put the cases up there. Okay, so. All right, so I will put 1 or 2 up there. This one you can do yourself. You're going to need your CPT and your ICD-10. The books are there. I'll put the CPT and the ICD-10 book on the side. The physician provides initial intensive care services for the evaluation and management of a critical ill newborn. Critical ill newborn. Inpatient for 1 day. So, if you guys have not got in with us in the beginning of this coding course, just go to the coding playlist. If you go to the coding playlist, I suggest you start with ICD-10. Because in ICD-10 is amazing. I gave you so much stuff in there. You ought to know how to do the coding. You guys know ICD-10 is a diagnosis. That's a diagnosis code. You go to ICD-10, you're going to look for the name of the issue with the patient. Okay, what is the issue with the patient? Okay, when you go to, what is it? You got 2 playlists? No, we got 1 ICD-10 playlist. I do have 2 playlists for coding because I got an ICD-10 and then I got a different coding, so you might see 2 different ones. But for ICD-10, that coding playlist, I want you to look at that one first. So if you are new to this class and you want to do the coding, you do have to do the medical terminology. There's no way you're going to get through without medical terminology. There are illustrations in your CPT book that you're going to do. You're going to look at The illustrations are, sections of the body, eye, ears, nose, and throat, different things like that, orthopedics, feet, bones, stuff like that. Um, in your medical terminology class, oh my God, we had, again, y'all know we had so much fun with that class. I just want y'all to make sure y'all also look at that. Now, this class will have a capstone, okay? Okay, this class is going to have a capstone. All right, the capstone is everything that we did in the classroom. Um, Now, this capstone is going to start with evaluation and management. Okay, it's going to start with evaluation and management. If you guys are having a little bit of a fickle finding codes in ICD-10, let me know. We can go back over that, but you still can go ahead and archive. Okay. Codes 99202, 99215 are reported based on the medical decision making and blank only. So yeah, that's the kind of stuff I want you to do. This is the last portion. Let me show you. This is the last portion. I'm just kind of scrolling through it so I can see what you guys are doing. But you guys are going to have a capstone in this class. This is the last section that we just did. That's just a review that we did. Y'all see I'm going backwards, but this is what we just did. Okay. So again, just download the workbook, but I don't want you to touch the workbook until you finish this class right here. Until you finish with this documentation guidelines we just did. Okay. Now you also can get your documentation guidelines also from the ICD-10 class that we did. Go to the ICD-10 class that we did. It's also in there. Okay. So the capstone that we're going to do. Let me see. Did we finish evaluation and management? Documentation. We done. So we are done with evaluation and management. Let me show you something. So as you can see here, that's it. That's the last class we did. Documentation and guidelines. Anesthesia, surgery, and integumentary system. Now, that's the start of our surgical cases. I've got to do the capstone to this class first before we go into that. And y'all got to be clear to me that y'all got the books. Because we can't start the surgical cases unless you have a CPT book or ICD-10 and you need your HCPCS. Okay, but HCPCS is down the line. Won't add any of that in right now. You only gonna have like 3 questions on that. Because that's gonna be the easiest thing. That's double medical equipment and drugs. Okay, so for you need your ICD-10. I put it over there. You need your CPT. Okay, if you need that step-by-step book, I want you to get it. If you need it, but if you need like a hard copy, go ahead and get the hard copy. So this is what you're going to do. Those of you who are working at home, this is not a micromanaged class. Y'all know I'm expecting to put y'all in the right place. Get your little chair and go on in your corner. Okay, if you need to make a little office, go to Home Depot, get your table, get your 2x4, and make your table, because you got to have a place to work. So when we do the capstone is going to run down what we did in evaluation and management. Today, this is it. This is the last class for evaluation and management. Before I start with anesthesia, I'm at a toss-up between hitting medicine before anesthesia because we've already done evaluation and management. Medicine is almost the same as office visits. It's the medicine codes is something is wrong with the patient. The patient has an issue. The medicine chapter is yay big. So that's where we're at right now. So once I finish with the capstone with you guys, then we're gonna move forward. The medicine section just gives you it kind of keeps you in that office mode. It keeps you in that mode where you're dealing with the patient that has headaches. The patient had high blood pressure or something like that. Patient has diabetes. The patient just coming in, stomach ache, or the patient is pregnant or something like that. So that's where we're at right now. But when we do the capstone, you still have to have your books. Okay, when we do the capstone, I'm gonna run down what we did. Okay, that's the capstone. I'm expecting the exercises to be done. I'm expecting the work that you're getting ready to do in your workbook not to be done, but to be get ready to do them because you're not gonna remember everything. Homework, when we give homework to students, is to help them to retain. It's to help them to retain. We don't grade their homework. We don't grade their homework. We grade tests that we initially give in a classroom. You guys don't get that. That's in the Sapphire Academy, but you still get put in the right place. And I want you guys to do the Sapphire Academy because I can give you that CPC pre-test. I can give you the rationales from that. I can give you the HIM test that I have, the interest test of what they give you when you are going to a hospital. And those of you who are taking the billing, taking the coding, go ahead and put in your application. Don't be afraid to put in your application because she or he may hire you anyway. They may hire you anyway. Okay, they say, oh, okay, you're in the classroom, you get ready to take your CPC. Okay, well, come on, can you pass this test? Yeah, go ahead. Okay, so we went over how to find the code, how to look for the code, right? Go to your tabular list. We talk about ICD-10. Go to your tabular list. Go to your index. Okay, find that code. You still got to check the code. You remember we went over that. What video? I don't know. He must be looking at my video. So you remember we went over that. Do not sleep on that. We do not have to pay federal aid student loan money to learn medical billing and coding. These three playlists have everything. Everything you see me showing is just like how I would be teaching my regular class at the school. I would be teaching them the same way. Okay? Because they're sitting with me for 8 hours, of course they will get more. But, you guys are getting enough to put you in that right spot. Don't let anybody tell you you cannot do anything. Even though you guys hear me when I come on Twitch, I'm just talking, I'm just rattling on, I'm just talking on Twitch. But the gist of it is to get you in the right place. Don't give up. If you hit that bottom floor, get up. It'll take a minute. Get up. Have your next plan. Y'all know I sleep with these books. If this doesn't work out, do something else. Did you hear what's his name? My guy, Kay Sinnott. He came on and he's talked about how he had mental distress. Some people have mental distress and they don't know. He knows that he has a mental distress. This guy is a millionaire. He's a YouTube Twitcher. I can't even remember what it is, but he's like a streamer, and he has so much money that he wants to do all these other things, but he doesn't even know how to do them. I'm not sure if he's went to college or whatever he does, but I know he just streams and he motivates millions of people. Oh my God, he motivates us. He motivates millions of people. So something knock you down, just get up. Something knock you down, just get up. If you're learning a new course, if you're learning a new skill, it doesn't, like I said, it doesn't even have to be billing and coding. Brush it off and get up. If you lose that job, get out there and go get another one. I don't care if it's in Burger King, as long as you're getting up and you're doing something. Get up and go out there. You don't want to live in here. You want to live there. Go live someplace else. But again, just don't give up. Don't give up. Okay. Now, for the capstone for this class, I probably won't do the capstone until 7 o'clock. It's probably be Friday night at 7 o'clock. That's going to be your capstone. Your next class is your capstone. In the schedule, it shows you it's time for us to do the capstone. Go look for that chat in there. I don't know. I don't know if I've showed you guys that. I don't know if that's in over here or not. Let's see. Attendance, recording chat. Some of you guys never seen the Sapphire portal. I'm gonna show y'all some of the Sapphire portal right. This is the Sapphire portal right here. And these are classes. So this is pretty much what I'm talking about. You can't see none of the chat, right? No. Okay. So I have chat in here, just like how I have chat right here. This is my Sapphire portal. Okay. And these are the classes here. These are the folders that you guys open up when you do the classes in the Sapphire portal. Now, you can see in the Sapphire portal, I have chat in there. I have schedule in there. We do Teams in here. I schedule Zooms in here. Um, everything is pretty much in here. That's the students folders right there. Um, well, this is what I want you to see. See where the classes are split? You got one, two, three. So you got medical billing, medical terminology, and coding. Same thing that you see here is just when you go to the Sapphire Academy, boom, you got it. Okay, you got it already. Okay, so so this is mine. There's no copyright here. They can't flag me for that. I own this. I own that format. I own that floor right there. So you don't have to worry about that. So this is where my students go when we do like a big chat. Like you see how you guys are in here like this. We all can go in there the same way that this is. I put the video up the same way and have all of them of the everybody around the video same way. Um, but here is where I go to look at. So you guys probably can see this. I'm trying to do this so you can see this. I do this every now and then. I haven't done it. I don't know. When's the last time I did this? About 8 months. Well, look, here, the syllabus is in here. I'm looking for the schedule. Everything is in here. So when you join the Sapphire Academy, you get access, syllabus, all the classes are in here. So this is the rest of the classes. The videos, they're on a whole different site. They're on a whole different site. This is the rest of what you get with your classes. You get a prereq for billing. You get prereq chat links. That's the YouTube links. That's probably in there. You get a prereq PowerPoint. We have to go all over these things, all through these things before you even start the class. I mean, if you're in the classroom, when you join it, you get an email with orientation materials and documents and stuff like that. See, there's the coding class. Um, the EHR is in here. Um, so I do have I have an EHR. Uh, it's a demo. It's for schools. It's not for for regular distribution. The EHR is to show my students how to do EHR. It's like a demo. It's like a kind of give them like practice. And I have a full one where they see what goes on in the front end, what goes on in the back end. Okay, it's like a 10 size circle. You guys know that. Um, in the step-by-step book, though, there is, I'm going to show you how that. There is something at the bottom that we can do. There's something at the bottom that can show you what an EHR looks like. Let me just go in here real quick. I want to just, this is the orientation right here. You see this? That's orientation for the school right there. When you get access to get in here, you just click on what you want. Here, that's all the recordings right there. Everything in red is the courses. Everything in red is the courses, okay? That's female. Your course number is 61014. Everything has a course number, 6106, 61103, 610. Every course that I had, integrity system, they all have, the class has a course. But what I did yesterday, which I'm still doing, I've named your courses so you guys can know which class you're in. The book chats, what books you need, that's in there. That's your syllabus. So I have three different ones. This syllabus is for 9 weeks. That syllabus is for 16 weeks. That syllabus is 20 weeks. There are some students who do the fast track. The fast track is I have students that can knock this whole class out in 16 weeks and they ready to take their test. And I have a lot, so they do pass. But that's like some of my students that are already working in a hospital. So I'm already working in a hospital. So this is my syllabus. Okay, this is the syllabus. It tells you about, what we're going to learn, what we're going to do, what is your objective. The objective is passing your CPC. Objective is learning medical billing and coding. Live lectures. We work with Google Drive. I send a lot of doctors to Google Drive. If you don't want to download, you can just look at what you need to inside the Sapphire Academy. Here, you guys remember when I was talking about when you join the class, we have to show the accreditation, how many hours it takes for you to do a subject. How many hours will it take for them to do this? How many hours will it take for them to do that? So I have different hours for different classes. Like your class, coding class, might be 60 hours and 20 hours theory. What's up with that? I don't know what that thing is. It might be 20 hours theory. And that depends on you. I have, like I said, I have some students that knock it out in a couple of weeks. And those students though are already in the hospital, like I said, so they may have that heads up already. I gotta find a thing for that. But again, I just wanted to kind of throw that up there. And again, that belongs to me. They don't have no copyright on that. Um, I just wanted to show y'all what that looks like. And again, this I can't put this stuff on YouTube. The only thing I do YouTube is really pretty much kind of talk about it. But again, like I said, I have to make these classes private at some point. Well, this is cool, private, and you're gonna have to get the classes in the Sapphire Academy. This is what I actually use when I do interview. Um, I might add a couple of things in there. This is what I'm asking them. So if I have a biller that's coming in, she better know what's on this paper. So that's an HR test that's in there. It's not a test, but it's HR questions. But again, that's access to Sapphire Academy. So I want y'all to go ahead, go on the website and check it out. And I'm joining Sapphire Academy because you're going to get those books that are in there, and you're also going to get the language of medicine book. I can't give you the language of medicine book on this one, on YouTube, but I can give you that book from the school. You just download that book. That book is $150 something, so I've given that to them free. That's the full book, okay? That's the full book. So definitely, definitely don't sleep on Sapphire Academy. So yeah, these are interview questions here, and this is just me showing you a little bit about the Sapphire portal. And this is Teams. If you have Microsoft already, if you don't, make a Microsoft email outlook.com, and then you're gonna go on the bottom and just say you want to add a email, or you want to add a Teams. You want to add an email, you're going to have a Sapphire email. I have to give you a Sapphire email in order for you to get in here. Okay? I have to give you a Sapphire email. Add that Sapphire email and it will get you in here. Okay? It will get you in here. Um, I was looking for, and this is for my students to print. They actually print this, and it's for them to keep up with their work. Okay, this is my documentation on attendance, and this is for the attendance directives. Okay, and it's not that, oh, you have to be there Monday, you have to be there Tuesday, but I do give you a document to say, okay, you need to be in this class at these amount of days for you to get this amount of work in, and this is where you're going to keep up with it at. Okay, this is where you're going to keep up with it. Date you started, date you signed in, or whatever. I know when you come in because I get a cue that it comes in. Okay, when I'm in the portal, you'll see a green check on my face. But when you're in there, I know when you're in there. But if you keep this paper and keep track, you can keep track of when you're in there, and you can always put this in your folder if you want to. Okay, so when we're doing our capstone, I want you guys to take heed to that, because the capstone is going to have so much stuff in it, more than what we see right here. For you to kind of retain your information. So even though you guys are on YouTube, I want you to still take heed to some of what you see in the Sapphire Academy. Okay, so let's drop that down. So the workbook. Let you guys see what that workbook looks like. They might have it. If you don't like ebooks, go to thrift.com. I'm pretty sure they got a hard copy for about $25. If you go to, I think Amazon has, this one might be about $40 on Amazon, but I don't know if it's an ebook. This one. So that's the workbook. That's the workbook. Okay, that's your step-by-step workbook. Okay, so that's what you're going to be working in, and it's going to take you a while. Take you a while to do that. So don't kill yourself with it. All right, just don't rush with it, because we're going to take 2 days to do the capstone anyway. Okay, we're going to take 2 days to do the capstone, and you'll have time to actually do that, whether you're in the Sapphire Academy class or not. Okay. So let's take this down. So your homework for tonight will be, let me get in here. Not this book yet. I'm just trying to see how much work they got for you in here before you actually get to the real stuff. Specific guidelines, surgery, anesthesia, theory. All right, so evaluation and management, we got theory, practical, and we got reports. Okay, same thing how we do for the ICD-10, same thing that we did for the CPT. So this is really considered the CPT and the ICD-10. They just kind of put it together. So let me get back in here. So this is it right here. So these are your exercises that you're going to be doing. So I'm suspecting by Monday at least you guys might be finished with that. I thought I had some water here. I guess I don't. Okay. So these are the exercises that you're going to be doing. Okay. Now, again, they may have rationale in the back of them, like in the regular books. They might have odd or even answers. Okay. But you guys just check out and see which ones they have. But again, this is what you're going to be doing. This is the workbook. Okay. So this, all the other stuff we should have done. The exercises that you saw in here that we were supposed to be doing, we're doing those tonight. You should be able to start this by Friday night. You should be able to start this by Friday night if you are not done. If you're done with the rest of the stuff that we did, that I just gave you, you should be doing tonight, then you're okay to do this. Okay, and if you kind of look at it, it's giving you exercises on what you did. Look, this one is consultation, admission, office visit, newborn care, established patient, inpatient, new patient, outpatient. Did we go over all of that? Yes. So you shouldn't have a problem actually doing this. And if you feel like you need more, go back over the chats. Go back over the chat. Okay? The 4 types of medical decision making in order of complexity from most to least complex as follows. Remember, we did those. I know I'm dying to give you the answer, but I can't give you the answer. You got to do it yourself. Okay? You got to do it yourself. But these are your exercises. Theory, practice, and then your reports at the end. It's going to be case reports. So you guys see how repetitious it is. All the books are repetitious. They mostly have the same thing in them. Okay? But that's your homework, and that's what you're going to do. And again, this is your second half of the chat that we did. We're going to have chat again Friday. I don't know if y'all don't like 7 o'clock. Let me know. We can do them early. I kind of do 7 o'clock. Everybody's home from work, and the kids are settled down. The kids are home and stuff like that. Sometimes I do 9. If I go out of town, y'all know I have to be a little bit flexible with the schedule. But that's what you guys are going to do, okay? So that's what's in the workbook. And again, I gave you the workbook. So you have a link over there for the workbook, okay? So when you archive this, with those of you who are going to archive, just pull up the chat box and it's in there. Okay? Let me see what else is in there. Let me see. All right, so it's pretty much, it's not that long. I'm just trying to see how long it is. I think you guys are good to go to kind of do that tonight. I think you're good to go to do that. Okay, anybody have any questions? Don't forget those codes that I actually put on the YouTube. See if you can get them. See if you can get them. I'll put some on today. They usually send me a thing and see how many people answered it. I put a thing on there one time before. I haven't even looked at it till like months later, and I saw all those answers. So I'm looking to see some answers today. Okay, looking to see some answers today. But again, like I said, do not give up. Okay, more than likely after this, I'll probably be on Twitch. When I'm on Twitch, I'm talking about other stuff on Twitch. It ain't got nothing to do with school. Okay, I'm just pretty much talking. Don't forget, it's Fabulous Me 1000 on Twitch. Okay, I'm probably going to change that, but I don't want to be stereotyping and put nothing on it. That's stereotype, so I'll put Fabulous Me. All right, so thank y'all for joining. I'm going to see y'all next time, okay? Next class. When's the next class? Friday, okay? And this is not the right one that's up there. Did I change this from here? It's probably changed. The thumbnail, I'm sure, is changed. I just didn't change this right here. That's all. Okay, so bye. Why is this here? Did it pop up there? No. Okay.